Welcome to the Full Freedom Life channel. Watch this video on the impact of chronic lower respiratory diseases in America. Click like and subscribe and learn to live simply, healthy, wealthy, and happy every day. Chronic lower respiratory diseases, otherwise known as CLRD, refer to a group of chronic conditions that affect the lower respiratory system, primarily the lungs. These diseases are characterized by persistent inflammation, narrowing of the airways, and progressive damage to the lung tissue over time. CLRDs are significant causes of morbidity and mortality worldwide. The most common types of CLRD in America include COPD or chronic obstructive pulmonary disease, asthma, and interstitial lung diseases. COPD is a progressive lung disease that encompasses chronic bronchitis and emphysema. It is often caused by long-term exposure to irritants, such as cigarette smoke, air pollution, and occupational hazards. Asthma, on the other hand, is a chronic condition marked by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. It is characterized by inflammation and constriction of the airways, which can be triggered by various factors, including allergens, exercise, and respiratory infections. CLRDs can have a significant impact on a person's quality of life, as they can result in reduced lung function, impaired respiratory function, and limitations in daily activities. Symptoms commonly associated with CLRDs include persistent cough, shortness of breath, wheezing, chest discomfort, and increased susceptibility to respiratory infections. Diagnosis of CLRDs typically involves a combination of medical history evaluation, physical examination, lung function tests, imaging studies such as chest x-rays or CT scans, and in some cases, blood tests. Treatment approaches for CLRDs aim to relieve symptoms, improve lung function, and slow down disease progression. They may include lifestyle medications, medication therapy such as bronchodilators, corticosteroids, or immunosuppressants, pulmonary rehabilitation, oxygen therapy, in severe cases, surgical interventions like lung transplantation. In America, the prevalence of CLRD is substantial. According to the Centers of Disease Control and Prevention, CDC, approximately 16 million adults in the United States have been diagnosed with COPD, and an estimated 25 million adults have asthma. The incidence and prevalence of these diseases vary across different demographic groups, with higher rates observed among older individuals, smokers, and those with low socioeconomic status. The management of CLRD involves a multidisciplinary approach, including smoking cessation, pharmacotherapy, pulmonary rehabilitation, and the avoidance of environmental triggers. However, despite advances in treatment and prevention, CLRD continues to pose significant challenges. Efforts to raise awareness, improve early detection, and enhance access to quality care are crucial in reducing the burden of CLRD in America. Prevention plays a crucial role in managing CLRDs. Strategies to reduce the risk of developing CLRDs include smoking cessation, avoiding exposure to environmental pollutants, practicing good respiratory hygiene, and ensuring appropriate vaccination against respiratory infections. Overall, CLRDs are chronic, progressive conditions that require long-term management and care. Early diagnosis, prompt intervention, and adherence to treatment plans can help individuals with CLRDs lead fulfilling lives and minimize the impact of these diseases on their well-being. Like this video so far? Then click like and subscribe to the Full Freedom Life channel. Learn how to live simply, healthy, wealthy, and happy every day. Preventing chronic lower respiratory diseases involves taking proactive steps to protect your respiratory health. Here are some tips to help prevent CLRDs. Number 1, don't smoke. Smoking is the leading cause of CLRDs, including COPD, chronic obstructive pulmonary disease. If you smoke, quitting is the single most important step you can take to prevent CLRDs. Avoid secondhand smoke as well. Number 2, avoid exposure to harmful pollutants. Minimize your exposure to environmental pollutants such as industrial chemicals, dust, fumes, and toxic substances. Use a protective equipment if you work in environments with poor air quality. Protect against respiratory infections is number 3. Practice good hygiene, such as frequent hand washing, to reduce the risk of respiratory infections. Get vaccinated against diseases like influenza and pneumonia, as these infections can worsen respiratory conditions. Number 4, maintain a healthy lifestyle. Follow a well-balanced diet rich in fruits, vegetables, and whole grains to support your overall health, including your respiratory system. Engage in regular exercise to keep your lungs strong and improve your cardiovascular fitness. Number 5, avoid exposure to allergens. Identify and minimize exposure to common allergens that can trigger respiratory symptoms such as dust mites, pollen, pet dander, and mold. Keep your living spaces clean and well ventilated. Protect your lungs from occupational hazards is number 6. If your work involves exposure to respiratory irritants or pollutants, ensure that you have proper ventilation and wear appropriate respiratory protection equipment as recommended by occupational safety guidelines. Number 6, monitor and manage pre-existing respiratory conditions. If you already have a respiratory condition such as asthma, work closely with your healthcare provider to manage your symptoms effectively. Follow your treatment plan, take medications as prescribed, and attend regular checkups. Next, practice proper breathing techniques. Learn and practice techniques such as deep breathing and pursed lip breathing, which can help improve lung function and reduce shortness of breath. Next, maintain a healthy weight. Obesity can increase the risk of developing respiratory diseases. Aim for a healthy weight by adopting a balanced diet and engaging in regular physical activity. And finally, get regular checkups. Regular visits to your healthcare provider can help identify any early signs of respiratory problems. Discuss your concerns and seek professional advice on maintaining your respiratory health. In conclusion, chronic lower respiratory diseases have a profound impact on the health of the American people. The high prevalence, mortality rates, respiratory symptoms, reduced lung function, exacerbations, economic burden, and health disparities associated with CLRD highlight the need for comprehensive strategies aimed at prevention, early detection, and management of these conditions. Efforts to reduce exposure to risk factors, promoting smoking cessation, improve air quality, and enhance access to healthcare services are crucial in mitigating the health impact of CLRD in the United States. Thank you for watching. Like, subscribe, and click the notification bell for more updates and for more upcoming videos. Till next time, bye-bye for now.